I'm Manasi Oza. I work as a family and couples therapist with Manoshanti, Bangalore, and I welcome you all to the first episode of Mind Matters with Manoshanti, a short form podcast where we discuss mental health one brief conversation at a time. Today we'll be discussing about trauma, and to talk about it with me is Dr. Sweta Sheth.
Hi.
She is a consultant psychiatrist with over a decade of experience in the field. I welcome you, Dr. Sweta.
Thank you, it's good to be here.
Right. So we'll dive right into the conversation. Dr. Sweta, what is trauma?
So here when we're talking of trauma, we're referring to psychological trauma. Okay, so just to be clear, trauma basically is any event that is very distressing, has a very negative impact on an individual, and overwhelms the individual's capacity to cope with it emotionally.
Mm-hmm.
So generally when we talk of trauma, it can be like something very significant, like say a natural disaster,
Mm-hmm.
or domestic assault, or sexual assault, a life-threatening injury or illness, and so on. But that said, even lesser events can cause trauma or evoke a traumatic response in some people.
Alright. So when you say a traumatic response, what exactly do you mean? What are some of the common trauma-related disorders that you see in practice, and what are the symptoms like?
Okay, so everybody is familiar with the term PTSD, right? It refers to post-traumatic stress disorder. So that is, it's a disorder that's seen after an individual has experienced very severe trauma. There are other, milder trauma-related disorders also, such as say acute stress response or adjustment disorders, which an individual may experience when they go through like lesser trauma. The symptoms of trauma can be quite varied. They affect an individual at multiple levels. So psychologically speaking, the individual may experience very intrusive flashbacks related to the trauma.
Right.
They may have, very intrusive recollections of the trauma. They may have nightmares related to the trauma, and because of this, traumatic memories are very easily triggered. So they may also try to avoid any reminders or anything that brings back memories of the trauma. So there may be a lot of avoidance.
Right.
There's also a lot of hyper arousal, so to say. Having a lot of very severe anxiety, panic attacks, palpitations, suddenly breaking out in cold sweats, and so on. So yeah, these are generally the most common symptoms that we see in trauma.
All right. And so if you could just tell us a little bit about what happens in the brain. These are the outward manifestations.
Okay, so obviously these changes are very biologically driven, right? So when an individual first, when they face an overwhelming situation, so the brain and the body go into this freeze, fight or flight mode. Right. So initially what happens is that there is a surge of stress hormones, which initially can be beneficial.
Yeah, because it's protective.
Yes, it's protective. It equips the individual to face that particular situation. So, but then with chronic exposure, to stress, or with chronically high levels of stress hormones, that has a detrimental effect on the brain. And it's the brain's limbic system, or the brain's emotional processing center, that takes the brunt of this trauma. So for example, if you take the amygdala, which is the fear center of the brain,
right,
what happens to the amygdala is that it remains in a state of chronic hyperactivation or hyperarousal, which means that the individual then kind of lives in a state of perpetual fear and anxiety. Then if you take the hippocampus, which is the memory center of the brain, with chronic exposure to stress hormones, it's seen that the hippocampus shrinks in size.
Okay.
Or if you take the prefrontal cortex,
right,
which controls all your higher order cognitions, it controls executive functions. So then the prefrontal cortex also malfunctions,
right,
which leads to cognitive difficulties also.
Right.
And if you take the case of children, so children with exposure to severe stress, especially in very early childhood, their brains are visibly shrunken. And as they develop, their brains don't wire properly, right? So neurologically, this is, there's a lot of alterations that are happening in the brain as well with trauma.
Right. Right. All right. And some of the symptoms that you mentioned, right? Like there's avoidance, there's anxiety, there's panic, that sets in sometimes.
Yes.
These symptoms sound also like they would overlap with other psychiatric
Yeah, that's the
disorders,
thing,
right?
right,
Yeah.
Mansi? There is always some amount of overlap. There is no one symptom that is very specific for this disorder. So, yes, there is overlap, and so it's best that if somebody is experiencing these symptoms, it's best that they go to a specialist, somebody who is familiar with trauma, somebody who's familiar with the diagnostic categories, with the kind of evaluation needed
Right.
to assess for traumatic disorders, and also familiar with the treatments.
Right. Actually, you're saying that a proper
Yeah, it would take a
diagnosis.
specialist to differentiate and to make a correct
Right.
diagnosis and give proper treatment.
Right. Right. And now that you mentioned treatment, what are some of the treatments available for people with PTSD or traumatic disorders?
So, like with all mental illness or psychiatric disorders, generally the best response is seen with a combination of medications and therapy.
Mm-hmm.
So, medications may be needed to treat, say, severe anxiety or to treat insomnia or other physical symptoms. And therapies, there are therapies that are specific for traumatic disorders.
Right.
So, if you take your regular talk therapies, your, CBT, cognitive behavior therapy, for example, it may not be
ideal.
It won't be ideal, it won't be effective. So, you have very specifically tailored treatments for traumatic disorders such as, say, EMDR, which is eye movement desensitization and relaxation.
Right.
It's proven to be very effective for trauma-related disorders. There are other kinds of therapy, like, say, cognitive processing therapy or progressive exposure therapy, which are also effective.
Right.
Then there's also virtual reality therapy,
Right.
which is like a newer form of treatment, and that is also it's picking up now.
Right. Right. So you're saying there are a slew of treatments and options available, and
Yes.
depending on what the individual needs,
Yes.
it can be tailored to their
Yes.
needs. All right. There's one thing that I've always wondered, and that is that are there any myths and misconceptions related to trauma and trauma-related disorders that you come across in
Obviously,
practice?
right? Because any psychiatric disorder is always surrounded by a lot of myths and misconceptions. So this is no different.
Right.
So I think one thing that people commonly get wrong is that it takes a very severe trauma to produce a traumatic response, which is not always true.
Right.
So a lot of times, like we all go through adversity. So a lot of times, even lesser events, like, say, being in a high pressure situation or major life transitions or loss, separation, things like these can also evoke a traumatic response. Things they can also affect individuals adversely, and they have a cumulative effect. So one thing may not necessarily produce a trauma response, but as things build up over time, it definitely affects the individual.
Right, and would you say that two individuals may react very differently to a similar traumatic
definitely.
event?
Definitely, right? So it's a lot of other factors are also important when it comes to determining how a person reacts to a traumatic event. So an individual, say, who's very resilient or receives has adequate social support or has receives timely treatment, they may kind of come out unscathed, through a traumatic experience. Other individuals may not be so lucky.
Right. And so while I suppose I know the answer to this one, I still want to ask the question. So when you say some people are resilient, they come out unscathed probably. Does it mean that those who don't, or those who are impacted by the trauma, are weak in any way?
Definitely not.
Yeah.
Definitely not. Right. So that's I don't like to use the term weak at all. Right. So it's different things that determine traumatic response. Right. So definitely mental weakness or strength, so to say, has nothing to do with it.
Right.
And Mansi, it's also seen that you don't have to experience the trauma firsthand. Okay, so like witnessing something very horrifying and being in a very
Right.
helpless, position, unable to do anything about it, that can also produce a traumatic trauma response,
Right.
right? So vicarious trauma or secondhand trauma is also real, and it's as real as first-hand trauma.
Right. Right. All right. This was a wonderful conversation. So, if I were to ask you three takeaways that anybody watching this episode might want from this conversation, what would you say it would be?
The first thing would be that trauma can happen to anybody. We all go through ups and downs in life, and so anybody can be affected, right? The second thing would be that it's important to get the right kind of help, the right kind of treatment, and the third thing would be that any trauma-related condition is treatable. Okay, so even if you look at the brain, because of neuroplasticity, even brain changes are reversible.
Right.
So which means that the disorder can also be treated. So never give up hope.
All right, that's lovely. So, for anybody watching, we have three takeaways for you. One, trauma can happen to anyone, and there's no shame in admitting that you've been impacted by a traumatic event. Two, that getting the right help and diagnosis and treatment is very important. And three, don't lose hope. You can recover from it. So thank you so much, Dr.
My
Sweta.
pleasure.
This was a wonderful conversation, and I will see you with another episode of Mind Matters with Manoshanti very soon. Thank you for watching.